I love coming to work every day knowing that I have the chance to be the best thing that ever happened to someone on the worst day of their life.
And then the other thing too is, you know that when you come on duty and whatever comes within your path, you know that you are making a difference for them.
Our sole mission is outcomes. Outcomes regionally, how we impact the health of the community, that's our biggest priority.
The mission at St. Luke's is to improve the health of the people in our community and provide transport in a safe and effective manner for them. Having access to people in rural and remote areas, I think that brings the health care to them that they might not otherwise have access to. So it really helps us support our mission because we can reach all those patients in our area.
St. Luke's Health System, they really support us in our program because they know that with the care that we provide in the aircraft that we have and we're giving back to the communities, they really hold us to a higher standard, the eye care values that are the pillars of St. Luke's Health System: integrity, compassion, accountability, respect, and excellence.
Air St. Luke's definitely carries out that mission by going out to parts of our community that are more rural and don't have the definitive services that we have here in Boise. So we fly to smaller communities and bring patients back to St. Luke's Regional where they are able to get definitive care. And if we're unable to give them the level of care that they need here in Boise, then we can fly them to an even higher level of care.
Air St. Luke's is a place, what we care about is not call volume. What we care about is not finances. Outcomes regionally, how we impact the health of the community, that's our biggest priority. It's not about doing it cheaper or doing more. It's about how we affect the health of this region, what we do as far as how can we support, for example, critical access hospitals, how we can support our local partnered EMS agencies. And I think that's a big driver because we're not about the bottom line. We're about doing what's right. It's easy to say, but it's hard to do.
Day to day, we come in ready for anything. We obviously have no idea what's coming at us, and it could be something very routine, and it could be something completely off the rails that we haven't done before or haven't done in a long time. So staying sharp is key.
We're an ICU in the air. We bring a lot of critical care medicine. We carry blood. We carry a whole host of critical care medicines that wouldn't be able to do if we were just like a mobile ER. We can do surgical procedures. We carry critical care ventilators and we carry a critical care monitor that allow us to really see what's going on with the patient and to treat the patient as they would in an ICU.
Okay, we're gonna take really good care of you.
Boise is a pretty decent sized metropolitan area, for those who don't know it. But the truth of the matter is we don't need to go far at all. Less than 10 minutes flight time before we are up into the mountains of Idaho. Those are my favorite kind of calls. The opportunity to go out and meet a patient who genuinely needs our help, not only from a medical or trauma standpoint, but just can't access that medical care by any other way, is really an exciting part of my job.
A lot of our rural communities, they are community-based hospitals that don't have a lot of resources and a lot of services, and so they really do rely on Air St. Luke's to get our team to them as quickly as possible to help them stabilize those critically ill children and babies and get them to downtown. So yeah, definitely if we weren't available, then there could be some outcomes that weren't as positive.
Our patient population is the entire population within our operational range. And for me, as well as for the system, one of the things they focus on significantly is that access, patient access. Very often we're in a situation where patient access doesn't mean can the patient get to the hospital, it means can we get to the patient, no matter where they are and no matter what's going on.
It's really heartwarming and just fulfilling to know that you can be there with them the greatest time of need and you can do the best that you can do with everything that you've been given. So whether it's education, the aircraft, everything involved, we've got great care.
I really enjoy the program here. It is absolutely the right mix of people, community, and operational capability that I'm really looking forward to working in.
I really enjoy the challenge. I also enjoy the teamwork. We work so fluidly together. It doesn't matter who my partner is. We come in, we have a good day, we get the job done, we walk home with pride, and I really like that.
I have not had the opportunity to work with another flight service. I've always worked here with Air St. Luke's and Idaho Helicopters, but there's a reason I've stayed for so long. I feel like it's very much like a family. We know each other, we know each other's names, we know about each other's families, and I think that's really important.
There's so many reasons that I continue to do this. For one, I love my job. I love St. Luke's. It's home for me. It's someplace that I will probably work until I retire. I love my team. I love being a nurse. I love taking care of patients. I love that human connection that I get with my patients and with my patients' families.
I can't imagine not being part of this program, the family atmosphere, the group. You just can't say enough about the support from both Idaho Helicopters and St. Luke's Health System, with them wanting to ensure that we are in amazing aircraft, that we are safe, that we're able to give back to our communities. Thank you to St. Luke's Health System and, again, Idaho Helicopters for allowing us to do what we love